Well, good evening, everybody, and welcome to another edition of Ask the Doctor. Today we are in part three of a series on cardiovascular health. It has been incredible news and information, so please type any questions you have in the chat. We will be able to ask the doctor at the end of our session here. So, we are going to be taught by an incredible person. He has been teaching and training and lecturing doctors all over the world. And it is the incredible Dr. Bob Rakowski.
Thank you always, Carol. Always a beautiful introduction, always there getting things ready. I love Tuesdays. Tuesdays are my very busiest day in the clinic, my late day. And so I come right up to the moment, and you always have things going. And I appreciate you so much for that. So we're talking about cardiovascular disease. The first session, we talked a lot about high blood pressure, the silent killer. And reality is we have a very, very, very positive influence on all of our physiology, and especially with a little knowledge, we can take control of our cardiac physiology and our vascular system and prevent challenges. It's probably easier than we know, but it just takes a little bit of consistency. Second part, we talked about the myth of cholesterol. It turns out that if you're over the age of 60, 92% of people over the age of 60, they actually have a survival benefit with higher levels of LDL cholesterol. Every age benefits from high HDL. It turns out that it's triglycerides that are the most telling and predictive of bad issues. We're going to move forward talking about stress, toxins, malnutrition, and physical inactivity. And we're going to let you know that these are the things that really kill people. So, can you reduce your stress? Maybe. You can get a more stress-free life, but what about those things you can't control? You can always control what goes on inside of you, and there's ways that we can buffer you against stress. Toxins are also related to cardiovascular challenges. We'll show how nutrition changed around a very serious cardiac event. And exercise, well, exercise creates cardiac fitness. But I'm a big fan of PubMed. So PubMed, National Library of Medicine, National Institutes of Health. When you look at the topic of stress and cardiovascular risk, you'll see that we have nearly 55 years of data, 56 years of data. But then look over the last couple of decades, just thousands of studies and increasing every single year. So over 23,000 studies linking stress to cardiovascular disease. So acute stress elevates something called epinephrine and norepinephrine, also known as adrenaline and noradrenaline. But cortisol is the chronic stress molecule. And very simply, I use PubMed. So if you were to type in that PubMed ID, you could find this study that shows, guess what? If you run high levels of stress, that is an independent risk factor for cardiovascular disease. It'll actually elevate blood pressure, elevate lipids, elevate inflammatory process, and it's just not good for us. So interesting statement, and I'll show a case study and a video from a patient on arrhythmia. But notice this, it says stress lowered the arrhythmic threshold. What does that mean? When you're stressed, your heart can beat irregularly. And by the way, that is something that can trigger a blood clot. So notice you're more likely to have an arrhythmia, you're more likely to have high blood pressure, and you're more likely to be inflamed and coagulation or blood clotting. So we want to find ways to buffer that stress. Other things that go on, the higher blood pressure is a challenge, increased blood sugar, which is a huge increased risk factor for heart attack and stroke. How about infection? Believe it or not, infection is also related to cardiovascular disease as well as other challenges. And then you're going to increase fat storage, especially around the abdomen. And if you get enough fat where you start compressing blood flow to liver and kidneys, your body will automatically elevate the blood pressure. So pretty fascinating study on post-traumatic stress disorder. Now, all of these are different types of emotional or mental challenges, but literally the risk of cardiovascular disease went up by almost 1.5x when people were suffering from post-traumatic stress disorder. And I tell people, I think stress has always been the number one killer. So this was a study on fossils. And when they looked at skulls, when they looked at the teeth, if they had teeth that were ground, like they call it bruxism, grinding your teeth at night due to stress, these individuals died an average of 15.4 years earlier. They can actually age very, very accurately the skeletal age of the skull and time of death. So pretty fascinating. What can we do about our stress? Well, believe it or not, deep breathing. And there's a PubMed study. Deep breathing lowers the resting heart rate and cortisol and psychological stress. So how often should we deep breathe? Well, as often as every breath, if you like, but certainly consciously find a way that if you're feeling maybe a little bit less than ideal, take a deep breath. And this wisdom goes a long way. I'm a big fan of Jocko Willink. This is one of his books, one of his many, Extreme Ownership. This is an elite Navy SEAL commander, and he ran the ground forces at Fallujah in Iraq. So one of the toughest military zones ever. And he says SEALs, the way they're trained is they're supposed to breathe first. Imagine being in this firefight with everything going on around you. You take a deep breath, then you assess the circumstance, you make a decision, then you execute an action. And execute might be, unfortunately, the right term for what the SEALs are going to be doing. And this PubMed study, what does it show? It says many, if not likely all, New World primates have elevated cortisol and cortisol resistance. So we're all running high levels of stress hormones. And by the way, this is a 2010 publication. So, think about, I know a lot of people that felt that 2020 and maybe even today was the most stressful time of their life. So we're going to get into some solutions. One of my favorite things is melatonin. The first thing I'm going to tell you is that the gut has 400 times the melatonin as the pineal gland, the brain. And I like people to supplement melatonin every waking hour. Why every hour? The half-life of melatonin is actually an hour. So an hour after you take it, it's basically halfway gone. And melatonin buffers the stress in the body by literally blocking the brain drive of stress on the adrenal glands. And so theanine, which is an amino acid in green tea, it promotes relaxation without drowsiness. So this calms the mind very, very nicely. And notice what it says. Theanine is good for relaxing, cognitive performance, emotional status, sleep quality, cancer, cardiovascular disease, obesity, common cold. And that's just the tip of the iceberg. When you take stress out of the mind, I'm going to tell you that I believe everything that works better. And my favorite superfood, Ganoderma, it actually is known to calm the body, the mind, and the spirit. I have PubMed references for all of those. Hard to imagine that the medical literature would say something calms the spirit, but there's your reference if you like. You can look that up. So clinical environmental medicine, I'm a big fan of the writing of Joe Pizzorno. He was the president of Bastyr University, a naturopathic college. Co-lectured with him at conferences, played basketball with him, a good guy. But here's what he said. The incidence of virtually every chronic disease in almost every age group has increased relentlessly over the past half century. A growing body of research has now documented that much, if not most, of this increase is due to the increasing levels of toxic metals and chemicals in the environment. So I'm glad someone's finally coming up with a really good textbook that says, hey, we're poisoning our planet, we're poisoning our people, and we're destroying our health with it. So this was a picture somewhere maybe 1940s, 1950s of them fogging these trees in a residential neighborhood with DDT. They didn't think anything of it. Notice the worker isn't wearing any protective gear. And you look at the incidence of cancer, how it's gone up, and all of these illnesses that we didn't know before. Well, guess what? These things accumulate in the environment. And notice what it says. They have half-lives measured in decades. And so they're going to be around for most of our lifetime and never, ever, ever broken down. So again, right from that wonderful publication, although some toxicants are clearly worse than others, there's huge variability according to each person's biochemical individuality, nutritional status, and exposure to other toxicants. And so we are unique, and a lot of us have a problem clearing some toxins. Some of us have a problem just clearing toxins in general. But we can do things. We can minimize our risk. We can maximize our nutrition. We can buffer our stress. And we can do some very targeted detoxification programs. So I've shared this clinical pearl over time: when in doubt, detox. But understand, detox is nutrient dependent, energy dependent, protein dependent. And there's so many things that we need to do. And if you want to do a really good detox, well, it's probably a good idea to hook up with a professional and say, what do you recommend, right? And someone that does that on a regular basis. So what about obesity? Well, quite simply, the negative effects of obesity on cardiovascular risk will accelerate the progression of most of the risk factors. And so you're at higher risk of stroke, heart attack, and even congestive heart failure. And what are the keys? Mostly diet and an exercise. So most of us know that. Why don't we do it? We're actually addicted to bad food. It takes some effort to train. We might not have energy. We might have pain. So there's things we may have to get over. But very, very simply, even with moderate physical activity, you can cut your risk of cardiovascular death in half or more. I tell people it's easier to stay out of trouble than get out of trouble, but it's never too late. Why not have a lifetime of fitness? You actually will find out that life is better when you're fit. I often ask people, I want you to take yourself and I want you to put yourself in your absolute worst physical shape of your lifetime. Think back to that time, right? I hope it's not today. And think about how you manage stress. Think about how much energy you had. Think about how much joy you had. And then put yourself in the best physical shape of your life. And I hope that's today. And then think about your energy. Think about your stress. Think about your joy. Think about how everything worked in your life. And there's a statement: how you do anything is how you do everything. If you let your physical fitness slip, likely a lot of other things are slipping as well. So when you start looking at cardiorespiratory fitness, in other words, aerobic capacity, and then looking at lipids like HDL and triglycerides, that is very, very predictive of death. So a simple blood marker and a test, can you run around the block and recover pretty quick, or even walk upstairs really well? If you can't do those things, you probably want to get on a good program. Over 43,000 studies on obesity and cardiac risk. I think there probably should be, more than that, but notice they've gone up rapidly over the last decades. So I did a fun little Zoom on comprehensive cardiac nutrition. And this is Ron Worley. And you know what? I'm just going to basically play his video. And this guy, basically, I met him when I was giving a health talk in Colorado. And, the person that invited him introduced him to me, and I shook his hand. I said, well, good to meet you. Well, how can I add value to your day? And he laughed. He said, I don't think you can. I said, well, why not? And he started to tell me his story. Well, I'll share his own video with you and you can see.
Hey guys, Ron Worley here. I'm going to tell you a little story. I happen to be at an open house right now and nobody's here. I'm out in the middle of nowhere. It's sort of boring. So what a better time to talk to you about some friends of mine and what they did for me. In order to do that, I need to back up and tell you what happened to me. So 3 years ago on August 16th, I was standing there talking and doing a seminar for a group of professionals, and I dropped dead. And I actually died twice on the floor there. The first time my wife tried to help me with some CPR and bring me back to life. That wasn't working. Thank God we had some professionals that had AED machines, and they hooked those up and brought me back to life. I had sudden cardiac arrest. Now, mind you, I was an ex-bodybuilder at the time. I ate right. I did everything right. My heart was not unhealthy. Just for some reason, it wasn't pumping enough blood into my body. What it's supposed to do is pump 65% of the body's blood from the left ventricle. Mine was only pumping 10. And only 2% of the people that have this problem actually survive the problem. So I was a lucky 2%er. That being said, I told that entire story to Deanna when I met her. Just by chance, she happened to come over and do an open house with her and Casey at my wife and I's house. and we just started rapping away there. And she was so inviting and welcome and warming, and she believes so hard in these products of hers. And a man named Dr. Bob. She tells me all about this and invites us to come meet Dr. Bob. And over the 3 years, I've tried absolutely everybody's products. I've done stem cell, and I'm on the cardiologist's pills. Nothing has fixed me over the 3 years. Right now, or before this, when I met her, I was really just treating the symptoms of heart failure with lots of medication that made me ill and feel worse, really. So I meet with Dr. Bob, and what a fantastic guy. He was super outgoing and funny, and he really was passionate about what he was doing. And so I listened to him talk, and while he's talking, he pops up a few videos, and lo and behold, there's 3 people that have the same exact thing I have, and he had managed to fix them. Now, he'll tell you he can't make claims, and he would not tell me he was going to fix me. He said he would like to. He said maybe. And so I just trusted him, and we went for it. He gave me a 10-day protocol to try. We did some testing before and after. And within those 10 days, there's some specific markers for heart failure that we look at to see if you're getting better. And all the markers changed for the better. Some of them even changed to a point where I was healthier than an actual healthy heart at my age. Case in point, I had 13,000 PVCs a day before meeting Dr. Bob. 13,000 PVCs means 13,000 negative heartbeats. And every time that happens, I get lightheaded, faint, I want to puke, and it really just disrupts my day, and it's all day long. And by the time 3 o'clock rolls around, I'm exhausted from having these episodes all day long. So it was quite annoying, and it took away from my day. I couldn't work out or any of that. Went and saw the doctor after the 10 days, and I'm having less than 800. 800 is the magic number that if you are a healthy person, they look for that number and see if it's an 800 or below, you're actually you're sitting pretty good. That's a healthy heart. Another one of the big markers was the size. I had stretched out into the 7s. A month prior, I was at a 6.5 on my heart, and I had shrank down to a 6. Which is a huge number because it took me 3 years to drop just a 1/4 centimeter. And within 10 days, Dr. Bob had me shrunk a 1/2 centimeter. This is a huge number for us. To see some productivity in such a short time was remarkable. And actually for me, I instantly felt after that 10 days was up, I instantly felt better. No longer was I having the chest burn. I didn't feel like my heart was underwater or that I couldn't breathe. I was able to go back to working out again. And I can't even tell you guys, if I saw these when I was sitting in the room just like you, and I didn't believe that it could work for me. I'm telling you, listen to these people.
So I'll go back to this. So his ejection fraction was down to 10%. He had sudden cardiac failure. He had acute cardiomyopathy. Doctors told him he had basically even just a 2% chance of surviving by the time he got to the hospital. He said he did about everything, including stem cells, with almost no results. Bunch of different drugs for congestive heart failure. So 13,000 PVCs, that stands for premature ventricular contractions. The atrium is a small part of the heart that pumps to the ventricles, and you can have atrial fibrillation, and it's annoying, but it's not life-threatening. That's not the case with premature ventricular contractions. Those can kill you. So less than 800, I had to do the math on that. So if your heart beats 72 beats a minute, 60 minutes an hour, that's going to be over 4,000 beats an hour times 24 hours a day. That's over 100,000 beats in a day. So less than 800 is basically less than 0.8%. So well less than 1%. And that's what we're able to achieve in 10 days when 3 years didn't work at all. And so, he was an athlete. I showed him this video of Betty Deloche. I'm not going to play that one now. This is a woman that was in congestive heart failure for 20 years. There she is actually on her 70th birthday, and it was her 50th wedding anniversary. And the reason I filmed her on that day is, she went from cardiac transplant list to ejection fraction of 65%, where she had the healthy heart of a 20-year-old. And she brought in her husband. Her husband said, "Hey, what would you like for our 50th anniversary?" And she said, "I want you to get on Dr. Bob's program. I want to keep you around for a while." So that was fun. So part of what we did with Ron was Ganoderma. It prevents abnormal clotting without promoting abnormal bleeding. This was a mouse study where they gave mouse a horrible clotting agent called chinic acid. And they said, okay, can we prevent heart attack or stroke? Well, they found they could with 10 to 20 milligrams per kilogram body weight of aspirin, which, by the way, you do that for a week or so, you're going to bleed out. You will definitely burn a hole in your gut. But we could actually do it with 60 micrograms per kilogram body weight of Ganoderma, which would be the equivalent of 2 cups of Ganoderma infused coffee, or the equivalent of 9 baby aspirin. And that, by the way, would be my body weight. Coenzyme Q10, they're calling it the first drug to improve cardiac mortality in over a decade. That's the European Heart Journal. So we gave Ron CoQ10. We gave him a combination of some taurine and magnesium. Taurine is very, very good at stabilizing membranes, as is magnesium. We know that omega-3s are really important, and I use an activated form of omega-3, which is turbocharged. And there's the study. It says clear benefit of melatonin or omega-3 for anti-arrhythmia. So, it seems when we did the stress reset, the activated omega-3s, the Ganoderma, the taurine, the magnesium, we also did an anti-inflammatory protocol. We got them better. And this was the protocol that we used. And the results speak for themselves. Ron wrote a book, From Ditches to Riches. I had a rough childhood. A couple of times he ended up in ditches from car wrecks where he was driving under the influence. And he finally decided to get his life in order. And now he's a multi-millionaire with multiple successful businesses. And very, very fortunately, his heart is doing much better as well. So we'll shift now to questions and answers. And Carol, did anybody type anything in to the chat?
Well, yes, we are getting started with our questions. A lot of people were quite amazed with those testimonies. Are you able to elaborate a little bit on the deep breathing that you were discussing?
Sure. So, the primary muscle of respiration is the diaphragm. And so the diaphragm is a dome-shaped muscle right here. It's separated between the chest cavity and the abdominal cavity. And when we breathe, we actually want to do belly breathing, like they almost call it like Buddha belly. So basically, I'm going to breathe and expand my abdomen as much as I can. My chest is also lifting up as I do that. And then when you exhale, your abdominals should go way, way in, but you've got to learn to breathe deep into your belly. What happens is the diaphragm moves downward. It expands the lungs as much as possible. And believe it or not, as it goes down, it also massages the intestines, massages the liver, massages the organs. And it's very, very good for you. And, there are people that have mastered deep breathing. And, if you never tried this or you never counted your breaths, I mean, most people are breathing 12, 16 or more times a minute. There's people that have mastered deep breathing that breathe 3 times a minute. And you can oxygenate that thoroughly that you can get down to that rate.
That's incredible. When you say Ganoderma for the heart, are you talking king of coffee or supplements?
I use spores, but of course you can have as much coffee as you wanted, So when we're talking about making a big change, I get 2 spores every waking hour. That's the most concentrated part of the plant. And that's what was anti-clotting. It calms the nervous system. It's anti-inflammatory. It can kill off deep infection. There's so many things that it can do.
That's amazing. Come on, guys, with all that information, there's no questions?
Well, one was sent to me beforehand. It was about Bell's palsy, and I was hoping there was a gentleman who had an acute onset Bell's palsy, and he thought to reach out to me, after about 5 days, and we put him on a protocol. similar thing. We did 2 scores every waking hour, and it completely and totally resolved. And in clinical practice, I personally have not had a patient in 30 years that saw me first for Bell's palsy that didn't put it in complete and total remission. So they really don't know what causes Bell's palsy. It could be a virus, it could be other things, but there's something that happens to the facial nerves and half the face becomes paralyzed. Well, when I give them a powerful anti-inflammatory like Ganoderma, Ganoderma also enhances the immune system as a powerful antiviral. And if it's a viral infection, it can go away. Medically, they tend to give them corticosteroids. Now, if it's inflammatory, not related to virus or infection, that will typically work. But if they have a virus or infection, then it can become permanent damage. And there's people that walk around with half their face drooping because they didn't get the right care up front.
Okay. Rhonda asked, how quickly does that usually respond?
Well, it depends on how bad the infection is, how quickly you got into the process, how healthy the patient is, but usually within days. So I had a gentleman reach out to me, and he was a great distance away. He says, Bob, I woke up this morning and half my face is drooping. What do you do? I said 2 scores every waking hour, and he was totally resolved in 3 days. Now, the gentleman that contacted me after 5 days, I think it took 7 to 10 days before it completely resolved. So he might have moved himself backward with his medical intervention.
Okay. Is Motrin the best solution for PMS? The gynecologist recommends it.
Well, it's absolutely not a solution. It's a Band-Aid, right? You're trying to buffer the symptoms. And so, PMS is I can't say I've ever experienced it, but there's people that have such serious issues that when I teach female endocrinology, there was a woman that was acquitted of murder on the PMS defense, and that's published in PubMed. And they could prove that her brain was so disrupted. But PMS could stand for please make it stop. It could stand for please remove symptom. It also could stand for pyridoxine makes sense. And pyridoxine is the chemical name for B6. And B6 is a critical nutrient that helps to convert glutamate, that I want to rip your head off neurotransmitter, to GABA. I'm at peace, I'm happy, I'm calm, I'm one with the universe. And these estrogens deplete B6, they deplete folic acid, they deplete B12, they deplete magnesium, and some people get into absolutely horrific brain chemistry patterns where they could either be suicidal or violent or a combination of each. And when we help them process out the estrogens, then they're better. But here's the challenge. Most of us are intoxicated by estrogens. In fact, the studies show we all are. There's estrogens in plastics, there's estrogens in pesticides, there's estrogens injected in animals, there's estrogens in nearly every breath of air that we breathe if we're in a big city. And so our body is intoxicated by these, and all of us are suffering the effects. Breast cancer is the number one cancer in women, prostate cancer is the number one cancer in men. These estrogens promote autoimmunity. Autoimmunity's gone up exponentially, thyroid dysfunction, you name it. So we've got to pull out these toxic estrogens. And there's ways to do it. We have medical foods that do it. We have synergistic nutrients. Ganoderma can be helpful. You want to eat all organic. You want to eat synergistic fruits and vegetables like broccoli, cauliflower, Brussels sprouts, cabbage. Those are the cruciferous families of vegetables. When I talk about fruit, phytonutrients that alkalize the system will accelerate and enhance the detox process.
Perfect. When the doctor tells you you have a heart murmur, but just ignore it, what's your advice on that? And if you could explain for those who don't know what a heart murmur is.
Well, you might want to get a second opinion. And so now that they've gotten really sophisticated with cardiac testing, they're actually suggesting that everybody has a very, very, very slight murmur. And so there can be absolutely no problem at all murmurs, or there could be, this is a really serious challenge murmur. So, whenever I find anything that sounds like a murmur in my office, I'm going to send them to a cardiologist. I want an expert opinion. And you know what? If you got a murmur, why not get an expert opinion? Go to a cardiologist and see, and then, okay, prove it to me. It's no big deal. and be content if they can prove it to you, and if not, keep seeking. But there's ways that we can enhance cardiac efficiency. And if you watch 1, 2, and 3 of this, everything that we're talking about, if you remove some of the stress off the heart, if you improve the efficiency of the heart, then no matter what the circumstances, it's going to last longer for you.
Perfect. Restless leg syndrome. Any suggestions for this, please?
Yeah, and so there's a lot of different things that can be done, but there's a problem with calming the brain motor activity when you sleep. And so they've talked about iron, they've talked about omega-3s, they've talked about magnesium, they talked about B vitamins. All of those things go into a brain precursor molecule called tetrahydrobiopterin, which is important in the methylation cycle and to make serotonin and dopamine and keep those things balanced. But when we put people on a good protocol, restless legs can go to rest. I mentioned the superfood Ganoderma. That's known to enhance serotonin, GABA, acetylcholine, and dopamine. And therefore, that in and of itself has shown to help some people with restless legs.
Perfect. Another question with the Bell's palsy. Would you do the steroids and antibiotics as well until the prescription is done?
I would have a liability if I answered that the way I want to answer it. So you need to prove to me that that's a valid suggestion. And so steroids are going to suppress the immune system. Antibiotics are going to be against life. And, we had a couple of decades where we were just, as a society, giving and taking way too many antibiotics. And look at the word anti against bios life. And now, over the last 5 years, the top research topic is actually the microbiome, the largest organ within our body, that which is so important for overall health. You kill the microbiome with antibiotics, and it's going to take time to replace it. And if you look at the medical literature and you said, hey, how often is a bacterial infection related to Bell's palsy, it would be pretty doggone rare. But if you give an antibiotic and a corticosteroid at the same time, they're working against each other because the corticosteroid is suppressing the immune system. And what if it's a virus? And then you're really putting the person in bad shape. So if they have really good, solid diagnostic criteria, and they knew that there was a bacterial infection present, and they also tested elevated inflammatory markers, they could possibly justify that. I've just seen those inappropriately recommended so many times. But no matter what you do, I would always do the Ganoderma spores because it's antiviral, antibacterial, anti-inflammatory, and enhances nerve growth factor.
Perfect. Scott says healthcare used to maintain heart disease is a large part is hereditary and you can only do so much after that. I assume you believe that is untrue and that we have very high degree of control over it.
Well, my great grandfather died at 37 of a heart attack. My grandfather died at 49 of a heart attack. When my dad was 49, he had a quadruple bypass. So then on my mother's side, her father was an insulin dependent diabetic. Her mother had rheumatoid arthritis. My mother was diagnosed with multiple sclerosis and rheumatoid arthritis at 29 and 35, was told she'd be in a wheelchair by 40. Guess what? She and my dad are both 80 years old because when my dad had his quadruple bypass, they said, okay, now we're going to eat healthy. Now we're going to exercise. Now we're going to take the vitamins. And so, and at 56, I have zero evidence of cardiovascular disease with great testing. So did I get great genes or did I take great care of them? And the concept of epigenetics above the genes, epigenetics are 90 to 95% of what we manifest, whereas genes are 5 to 10%. So keep in mind when people have a cardiovascular risk, they probably live in the same household with someone else for a big portion of their early life and develop bad habits that could promote cardiovascular disease as well. So I'm a huge fan of empowering people above and beyond their genes, epigenetics, through choices, and saying, so what the genes are, if you've got a pulse, you got a prayer, let's maximize your wellness. And I believe we can.
Perfect. Is there anything else this evening, my friends? Give him a second to type. Anybody? You might be off the hook really early tonight, Dr. Bob.
Well, then I will relax, enjoy, and wish everybody health, happiness, and success always. I appreciate you. You know, if you like this and you're part of our Facebook group, pay it forward. I'll put it on my YouTube channel, the recording. So, you know, this is turning out to be a year of human empowerment. You know, I see a lot of people that are asking really good questions about actually taking care of health, not waiting for a crisis, not waiting for some external factor to help them get better. Health starts inside, and guess what? The cures are all in there. So let's just take really good care of ourselves and each other and use this as a springboard to a better world.
Awesome. Everybody, feel free to unmute and say goodnight.
Thanks,
Dr.
Carol.
Thank you, Dr.
Bob.
Bob.
Good night.
Thank you, Dr.
Thanks, Dr. Bob. Have a great evening.
Thank you.